a great event for you today. As a brief note, closed captioning is available in English through the options at the bottom of your screen if you would like to use that. Next slide. And we really hope this will be an engaging and participatory conversation today. And the best way to interact is through the Q&A session, which will be held at the end of the event, where you will have a chance to ask the panelists questions. And we are using the Mentimeter platform to collect questions throughout this event. There are 3 ways to access the platform. First, by clicking on the link in the chat. This will be posted throughout the session for easy access. A second way is to scan the QR code on the screen to the right with your phone's camera to join the link. And a third way is to go to menti.com and type the code in the prompt. And in addition to asking your own questions, you can also upvote other questions from participants that have been asked. And although we may not have a chance to get to every question, we will share these questions with panelists and the project team for reflection in their work. So we really appreciate these questions and encourage you to continue to add questions throughout this session. We also request that you please keep yourself muted during this event and encourage you to participate using the Zoom chat feature, as well as participant polls that will pop up during the session. Next slide. So during the webinar today, we will hear from several expert panelists, as well as the results for development team that collaborated on this work. We'll spend about 15 minutes providing a framework and introduction to the work, followed by about 40 minutes for the panelists, and save at least 25 minutes for the Q&A session at the end of the event. And as a reminder, please utilize the Mentimeter link to add and upvote questions throughout this session. And with that, I will turn it over to Dr. Patrizia Fracassi, Senior Nutrition and Food Systems Officer at FAO, for introductory remarks.
Thank you so much, Lorna. Hello and welcome everyone again. In 2021, during the Tokyo Nutrition for Growth Summit, FAO pledged to strengthen country efforts to promote better nutrition for all through more efficient, inclusive, resilient, and sustainable agri-food systems. Today, we are pleased to share with you some of our work to support these efforts. Over the last year, the FAO Investment Center and the Food and Nutrition Division have partnered with Results for Development to develop practical guidance on how to design agri-food system investments that enable healthy diets for better nutrition, which you will hear about next from the panelists. To start, I would like to describe what we mean by an agri-food system investment, a term we will use throughout the webinar, which is based on the Sustainable Agri-Food System Framework. FAO uses the term agri-food system to encompass the primary production of food and non-food agriculture products, such as fibers, fuels, and raw materials. For the purpose of our collaboration with R4D, we have explored primarily the role of agri-food systems in enabling healthy diets for all through the production of safe and nutritious foods. Within this framework, there are 5 parts of agri-food systems: systems supporting food production, food supply chains, food environment, consumer behavior, and diets. Each of these are interconnected and, if optimized, can contribute significantly to nutrition and health outcomes, in addition to broader societal impacts and impacts on the economy. An agri-food system investment can be designed to span across each of these areas in an holistic way. For example, by including components on agricultural development, food value chain development, financial inclusion and livelihoods, and community engagement. On their own, these investments may address underlying determinants of malnutrition, but there are also opportunities to optimize nutrition gains as co-benefits that meet the interests of different sectors. At FAO, the Food and Nutrition Division, in collaboration with other divisions and partners, has developed approaches to define how programs can maximize nutrition gains by using the theory of change and related impact pathways. Defining the impact pathway is an important process to identify entry points for nutrition and optimize how programs can achieve dietary diversity and healthy diets. This is one way to systematize processes for better nutrition. It is really important, given the current crisis, to think about how food systems can become more resilient. We know that food is at the center of climate change, biodiversity, and nutrition. We know the challenges in each one of these areas, but what we are missing is to look at the connections and reposition food at the center of our discourse. Next, we will hear from R4D on ways agri-food systems investments can be designed to maximize nutrition gains. The findings will be documented in a country highlight report, which will be published next year. I will pass now the floor to Mary. Over to you, Mary. Thank you so much.
Thank you so much, Patrizia. I hope everyone can hear me all right. Thank you everyone for joining. We're excited to discuss this with you today. So as Patrizia has mentioned, I'll share some of the findings from this forthcoming report, which provides guidance on developing and designing investments to enable healthy diets for better nutrition. Before we dive in, we have a poll for you all. So if our facilitator can please pop that up on our screen. We'd love to learn more about the audience. So please select the response that best suits you or reflects your situation. In your current role, how often do you think about tailoring nutrition-sensitive programs for better nutrition outcomes? And we'll just give it, I see responses coming in quickly. So we'll just give it a few seconds for responses. And really keen to hear, and it looks like many people have answered. Most people have answered. We'll give it about 5 more seconds. All right, let's show the results. I think that will come up on the screen. Can we see the results?
Yes.
Okay, fantastic.
Yes.
So I could see it. I wasn't sure if everyone else can. So fantastic. We have the majority of folks joining who often or sometimes think about tailoring nutrition-sensitive programs for better nutrition. We're so glad to have you here and keen to share more on this, see if what we're discussing today resonates. How can we together kind of expand more? We're just as glad to have folks joining who answered rarely or never. We hope that this can be the start of some conversations moving forward. So thank you everyone for answering that poll. So we'll move on to share a little bit more about the work. We can move to the next slide. This work was done in 2 parts. So first we started with a review of the evidence on what we know about what works to improve dietary diversity, with a review of recent reviews and one meta-analysis, including the ones shown on the screen, as well as others, and also conducted a review on what we know about the costs and benefits of enabling healthy diets. Next slide. So from this review, we found 10 nutrition-sensitive interventions improve dietary diversity by targeting different aspects of the agri-food system. So as the framework that Patrizia mentioned, these interventions cut across the different components of it. So this includes cross-cutting drivers, including gender equity and women's empowerment in agriculture and household decision-making. Interventions focused within food production and supply chain, including nutrition education in farming curriculum and ag extension programs to support production of diverse and nutritious crops. Also includes investment in irrigation to support year-round cropping, biofortification, and the promotion of small-scale livestock production and fish farming. Within the food environment, this includes facilitation of market access through farmer and producer organizations to increase the availability of nutritious foods at markets, as well as value chain investments to add and preserve nutrition available at markets. And then finally, most commonly, of course, consumer behavior. So interventions focused on social behavior change communication, education to communities to promote the consumption of diverse and nutritious foods through knowledge generation, as well as promotion of home and school gardening, as well as food safety and hygiene education, especially for homegrown foods. This list shown on the screen, these are from a programmatic aspect. In addition to programming, taking an agri-food system approach to policy making can also important to foster an enabling environment for healthy diets and progress on nutrition outcomes. And there's been a recent body of work on this topic on policymaking that my colleagues will put a link in the chat if you're interested in reading more on this aspect for some practical guidance here as well on policymaking to support nutrition outcomes. We can go to the next slide, please. So we wanted to share a few key takeaways from the review. So first, to say that the evidence is quite strong on what works to increase the consumption of nutritious foods. And so by this, we mean, for example, nutrition education, behavior change communication, home gardening activities. These are the most commonly integrated activities for nutrition. However, there's less information or practice on what works on the supply side or linking the supply and demand side interventions. So for example, how to ensure healthy, nutritious foods are available at markets, and what incentivizes smallholder farmers to produce more nutritious foods, so expanding from cash crops. So some key questions that have begun to be explored, but still seeking more information on what works. Next, clearly there's no one way to optimize nutrition gains within agri-food systems. There's no standard package, so to speak, as there is maybe within the health sector, because it is so context dependent and success relies on so many factors. But we can systematize practices that help identify nutrition, entry points for nutrition. So so there are ways to still enable and enhance nutrition without, quote unquote, a standard practice, so to speak. Next, tailoring agri-food system programs to enable healthy diets does inherently come with additional costs. So for example, having staff available, nutritionists, et cetera. Depending on the activities, other costs, but benefits can make the investment worthwhile, whether this is for health and nutrition or economic societal benefits. However, the challenge is that there's limited data on costs and benefits to make this case more broadly, although the evidence is growing, including with a standard common approach available through Seams Nutrition, which we'll hear about later in the panel, as well as costing tools that FAO has used to support this process along with the impact pathway approaches. So next slide, please. In the second part of this work, we conducted 4 case studies, each reviewing key aspects of how agri-food system investments enable healthy diets. So in Ethiopia, we worked with the Sakota Declaration, where we documented an innovative annual planning processes. We will hear more about these from Dr. Sisay soon. As well as a review of the agricultural growth program and how embedding nutrition has evolved over time in the second iteration of the program. In India, we reviewed how a large-scale agri-food system project embeds nutrition activities throughout core components, including supply and demand side components. In Bangladesh, we reviewed the process of country investment plans, bringing partners together to fund nutrition. It's gone through 3 iterations of this. We're excited to hear more about this in the panel as well. And in Palestine, how the National Investment Plan puts food at the center of agricultural investments. We'll learn and hear more from these examples during the panel section. Next slide, please. So together in consultation with stakeholders, we developed a set of 3 emerging themes, as well as recommended actions for decision makers when designing investments and implementing as well. So the 3 are on the screen, but we'll go through each one by one. So next slide, please. So the first is that all components of an agri-food system project can play a role in enabling healthy diets if explicitly designed. And these 4 actions describe ways to make it explicit so that we're sending signals on how nutrition can be enhanced, nutrition gains. So the first action is to involve individuals with nutrition expertise in decision-making process from concept development to implementation. So essentially, the earlier in the investment life cycle, the better. The second action is to add an explicit healthy diet objective or result area into large-scale agri-food system projects, which can be a range of outcomes directly related to the project, including, for example, nutrient value of crops. It doesn't necessarily have to be a nutrition objective, but broader healthy diet objective. And to do this as a signal to program implementers to design project components in a way that maximizes nutrition impact. So essentially embedding this within the core aspects of the program, whether it's an objective or result area. The third is to use the impact pathway approach to identify entry points to improve diets through access, availability, and consumption, especially when looking at the linkages between supply and demand. This could be a powerful approach to do so in a systematic way. And then fourthly, to add a nutrition sensitive indicators to monitor and evaluate plans to track measurable, realistic progress against outcomes. So this is of course linked with action 1.2, where objectives results areas are built in. We'd like to monitor them to see how things are working. Next theme, please. Next slide. The second theme is in this review, the growing evidence based on costs and benefits of integrating nutrition within agri-food system programs can support investment decisions that enable healthy diets for better nutrition. So first, for investments to contribute to the evidence base of economic evaluation by tracking costs and benefits of implementing nutrition-sensitive agri-food systems programs. So for example, by including costing components to monitoring frameworks within investments and programs. And the second action here is about data use. So essentially to feed this information collected directly into program evolution. Learn about what works at what cost, what's the most value for money, how is this gonna interest budget holders and decision makers in designing programs and policies based on rationale of benefits. Next slide, please. And finally, the third theme, designing investments to strengthen the existing agri-food system is critical to ensure sustainability and long-term impact on healthy diets. So 4 actions here. So first, to make investments that create a supportive policy environment for nutrition. Second, to make investments that strengthen systems of coordination and annual planning, such as with multi-stakeholder country investment plans. We'll hear more about this. Third, to strengthen existing government systems and delivery platforms to avoid fragmentation as much as possible and to promote sustainability, so invest in existing infrastructure. And third, alongside that, allocate budget for capacity building and learning exchange at subnational levels, including training and tools. So ensuring that investments in the system and infrastructure are there and people are trained and well capacitated to ensure that nutrition gains are embedded throughout in the system. Next slide, please. So this is a very brief overview. We wanted to introduce the work very quickly and move into the panel, which we're excited to turn to next. Before I do so, I'd like to say thank you to everyone who's contributed, including participants in the workshops that we've conducted, one in Ethiopia and Bangladesh, hosted with partners listed on the screen. The this was made possible through their contributions. And now I'd like to move on to the panel section of the webinar, where we'll hear more from these examples that I briefly mentioned. I will pass to my colleague, Albertha Nyaku, who is the lead for the team lead for Nutrition at Results for Development. Albertha, over to you.
Hello, can you all hear me?
Yes, we can.
Yeah, wonderful. Yeah, thank you so much, Mary. Our next section is going to feature 5 panelists who have all been involved. As Mary has mentioned, they've been involved in various aspects of the development of these case studies. I'm going to pose a few questions to each panelist, and we hope that each panelist will spend about 5 minutes in responding to the questions. It's my pleasure to introduce Dr. Sise Bortena, the Senior Program Manager of the Sekoda Declaration Program, which is the stunting reduction program in Ethiopia. Dr. Sise is he's manager of the program delivery unit of this program in Ethiopia. And the program is now at its expansion phase after completing a very successful innovation phase. So we'll be hearing about one of these innovations today. So my question to you, Dr. Sise, is how has the Sekoda declaration process of costed Woreda-based planning helped to strengthen multi-sectoral coordination and financing of agri-food system investments? Over to you, Dr. Sise.
Thank you so much for your kind introduction. Just to give you the context, the Sekoda Declaration is the Ethiopian government commitment for ending stunting among children under 2 years by 2030. As it was indicated, the costed Woreda-based plan is one of the 6 innovations that was successfully tested in the past 5 years in the 40 innovation phase Woreda. And the Sekoda Declaration was identified as one of the innovations of the game-changing solutions for the Ethiopian food system transformation that is implemented by 10 sector ministries. And this costed Woreda-based plan is implemented both by a bottom-up as well as also top-down multi-sectoral planning approach. And each of the expansion phase Woredas currently is 240 develop a tailored costed yearly plan through a bottom-up planning process. And can you project the slide, please? And each of the expansion phase Woredas develop a tailored costed yearly plan through the bottom-up planning process. And the costed plans are consolidated, as you can see on the chart, from bottom-up that consists of nutrition-sensitive, nutrition-specific, as well as also climate-smart infrastructure interventions that require resources to be financed both from the federal government, regional government, development partners, as well as also the community contribution, both at the national and subnational level. The interventions within the Woreda plans are prioritized by implementing sectors. As I mentioned, 10 sectors are working together to ensure coordination and accountability. And once that plan is drafted at lower level, which we call them the Woreda level, it will go upwards to zonal, regional level for further review and approval and also financing at regional and federal level. Currently, the federal government is allocating over 10 million USD annually for the Coastal Warada Based Plan, which is also equivalently matched by the regional governments and also contribution from development partners. Next slide. So the second tool that we are using also for financing and resource mobilization is the resource tracking and partnership management tool. This tool is helping us in terms of proper management of the various stakeholders that is taking part in the Sakota Declaration implementation, as well as also the various sectors implementing the nutrition sensitive, specific, and infrastructure interventions, and also evidence-based decision-making in financial allocation, utilization, and also tracking the expenditures. And based on that, to advocate at all levels, especially crucial for successful implementation. The resource tracking and partnership management tool utilizes a web-based stakeholder mapping tool to assist the waradas, these are districts, and also the regional sectors, to identify, map, and prioritize the financial need, the financial allocation, as well as also budgetary spending among the implementing sectors and development partners. The resource tracking and partnership management tool, which is currently utilizes the Ethiopian Public Health Institute server, also helps us to generate various analytical financial information to facilitate the stakeholder analysis and also the various stakeholders' contribution. Next. So these tools, the resource tracking and partnership management tools together highlight the financial gaps in the waradas, and also it enables the aligning across sectors and also development partners towards the priorities that are identified at community level, especially at district level, to finance the priority interventions that directly contribute to improved diet and also to improved nutrition that also contribute towards stunting reduction, and also determine whether priority areas receive adequate financing, and of course this strengthens accountability among the various implementing sectors and also development partners. These tools will be very essential to monitor also implementation of the resource mobilization plan that we have already put to allocate for the expansion of 5 years expansion phase that is indicated in the investment plan. I thank you. Over to you.
Thank you so much, Dr. Sise. Participants, just remember to put in your questions, whatever questions you have. Now, I'm going to our second panelist, Dr. Adriano Spinelli, an investment and strategic planning advisor for FAO, who will share experience supporting the development of Bangladesh's third country investment plan for sustainable, nutrition sensitive, and resilient food systems, CIP3. My question to you, Dr. Spinelli, is how useful is the CIP3 in informing policymakers or development partners and in prioritizing nutrition sensitive investments within the food system in Bangladesh? Over to you, Dr. Spinelli.
Thank you very much, Alberta, and good afternoon, good morning, everybody. It's a pleasure to be here and presenting you the Bangladesh CIP3. First of all, let me start by saying that this is the third edition of a country investment plan, and this demonstrates that Bangladesh has a long-term commitment in prioritizing nutrition investments, and also witnesses the FAO technical support role to Bangladesh. So essentially, the Bangladesh country investment plan is the results of an extensive consultative process at both national and regional level, involving multiple institutions, 19 among agencies and ministries of the government and actors from both the public and private sectors at central and local level. So 6 divisions were consulted during the process. The CIP3 adopts a nutrition sensitive lens, which means that investments are given more importance when contributed directly to improving nutritional outcomes. And the CIP3 maps these nutrition sensitive investments and especially related government and donor investing institutions into 5 pillars and 35 investment programs. If you could put the slide, please. And these slides provide the nexus from policy, which is on the top left corner, the Food and Nutrition Security Policy 2020. And then from the policy, we go through the priority actions with the plan of action, and then to eventually the counter investment plan, which helps ensuring that the strategic vision of the government is translated into investment priorities agreed by all stakeholders. So through a systemic approach, it identifies investment gaps and opportunities. It is therefore a useful tool to inform policymakers, investors, and also a program manager designing programs within Bangladesh. So it's a 5 years plan and covers from 2021 to 25, and is estimated, the total cost is estimated at 31.5 billion USD, and this total is 20.2 billion when nutrition weighted. So out of the total, 8 billion only are investments on post-harvest transformation and value addition. And within the process of formulating the CIP3, investment gaps were identified. This is just an example, were identified in cold storage facilities and agro-processing. And these, as we all know, are essential components in the agricultural transformation agenda of the government of Bangladesh. So this evidence contributed to inform the dialogue led by Ministry of Agriculture of Bangladesh among the government, private sector, and development partners representatives during FAO Hand-in-Hand Investment Forum, which was held in October in 2022 in Rome. So this is just an example of potential uses of CIP3. I look forward to discuss more, and over to you, Alberta. Thank you.
Thank you so much. Now our next panelist is Dr. Del Aquila, who works with a public research institute in Italy and is a policy advisor at FAO in the West Bank Gaza Strip office. In that role, he works on the first program dedicated to food and nutrition security impact, resilience, sustainability, and transformation. So my question to you, Dr. Del Aquila, is how has Palestine's National Investment Plan helped put food-based nutrition at the center of agricultural investments? Over to you, Dr. Aquila.
Okay. in a complex context such as Palestine, the National Investment Plan for Food and Nutrition Security represent an ambitious attempt to ensure higher coordination, effectiveness, and efficiency in the use of public resources. As in the previous case, it is the result of a very wide consultation process involving policy decision makers, stakeholders, donor countries, and a consistent fabric of NGO and CSOs, which are relevant partner at the implementation level. And it is an operational arm of the food and food nutrition security policy that the government of Palestine endorsed in 2020. Next, please. This is just a quick picture of the situation in terms of food insecurity and malnutrition in Palestine. The usual ways of measuring food insecurity are depicting a picture that is in the last years have been quite stable, around more than one third of the population in condition of severely or moderately food insecurity. As the comparison between Gaza and West Bank suggests, one of the the major driver of food insecurity is the military occupation, which is which gives part of the basic explanation of this situation of food security in Gaza, and also the data for West Bank are aggregated. The area C and the areas of West Bank where the military occupation, the presence, the military control is stronger, are also areas where food insecurity presents higher level. The nutritional picture follows accordingly, although surveys, exhaustive surveys are date back to about 10 years ago. The picture of the nutritional situation of the malnutrition is consistent with the territorial distribution of food insecurity, and this is basically tells us that poverty and unemployment in the areas where the weight of occupation on the capacity of using natural resources, developing economic activities is stronger, is affecting the context that the national food and nutrition policy is trying to deal with. Next slide. The way the government with the support, significant support of FAO, both at local level and from the investment center. The next, please, has been okay. The way that the government has been trying to put on operational, thank you, on operational conditions, the national priorities and the strategic objectives of the national food and nutrition security policy is based on 6 components. One, the first one gathers the nutrition specific investment. which are more strictly related to address the immediate causes of malnutrition, while the other components of the plan are nutrition sensitive programming of investment, in the sense that they try to address the underlying causes of malnutrition, poverty and food insecurity, drawing upon sectors that have been connected analytically through pathways that look like a subsection of the food system, mainly looking at agricultural production and related impacts, also at income generating activities and related impacts on nutrition. Next slide. The first component instead is, as I said before, dealing mostly with the immediate causes of malnutrition, and is consistent with the contribution that the Ministry of Health has given to this topic, in the sense that the points for which are stated objectives and measurable targets are mainly the treatment of malnutrition, prevention measures, awareness raising, and in general behavioral changes, and also data generation and surveillance capacity. This is in synthesis, the attempt that has been pursued in Palestine to mainstream nutrition in a wider plan that is targeting food security and the causes of malnutrition related to unemployment and poverty. Thank you.
Thank you so much, Dr. Akila. Next, we are going to be joined by Dr. Philippe Dizon, Senior Economist at the World Bank in the Global Engagement Unit of the Agriculture and Food Global Practice. My question to you, Dr. Dizon, is how is the World Bank supporting countries in designing investments to maximize the nutrition impact? Over to you, Dr. Dizon.
Thank you very much, Alberta. And good morning, good afternoon to everyone. Thank you for having me in this panel. First, I'd like to start by congratulating R4D and FAO for pulling together this really important report. Now, in response to your question, Alberta, I would like to share 2 points. The first is on what we are doing, which is to monitor and steer the nutrition investments that the bank finances in the agriculture and food space. And the second, if you allow me, is in how we could possibly do better. So first on what we're doing, countries and their governments are and should be at the lead in defining what public goods they choose to invest in and how. Now, the bank's goal is to serve these client countries, and we support in designing and in financing nutrition-sensitive and nutrition-specific investments. In total, over a 2-year period from 2020 to 2022, the bank had committed up to $2.5 billion in financing for nutrition contributing activities. And as declared in a Nutrition for Growth Summit, or N4G, in Tokyo last year, the expectation is that we maintain or that we grow this level of financing over the next following years. The agriculture and food global practice of the bank, where I currently sit, delivers a small but growing part of this bank's financing to nutrition contributing activities. Over the last 1-year period, up to June 2022, the agriculture and food practice delivered over $350 million of direct financing to nutrition contributing activities. Now, what I think is fundamental and something I'm proud of is that my team has started to much more systematically and in real time track how much of the bank's financing in the agriculture and food space is allocated to nutrition contributing activities. More importantly, this system of tracking is also being used to provide feedback to our country-based teams on how to better mainstream nutrition activities in the design of investments. The principles of how we account for such financing currently coincides very well with the practice-based guidance that Mary was talking about earlier when we started this session. We are guided by the idea that all components of an agri-food system project can play a role in enabling healthy diets if explicitly designed. And so we think of nutrition as a cross-cutting outcome as opposed to a compartmentalized set of activities. Essentially, when our team currently reviews drafts of investment documents that are under preparation, we do look for the points that Mary had raised earlier, particularly under theme 1, and I won't go into those in much detail. But as I mentioned, what we do is more than an accounting of nutrition contributing activities in our portfolio. It is also a feedback mechanism to guide the design of projects. But second, I'd like to more briefly touch on how we, the bank and others, could do better in this space. And my sense is that there is a need to rethink more holistically, to think more holistically of a range of interventions and a range of outcomes across the entire agri-food system. Moving forward, I believe we need to think broadly. So on one hand, on the variety of levers across the agri-food system that we can leverage, and on the other hand, on a broader set of outcomes that the agri-food system can deliver on. And so not just nutrition, but also climate, environment, poverty, equity, gender, and so on. We need to meet our client countries halfway to think about the variety of challenges that they need to address, where healthy diets and nutrition fit into that, and what this would mean for the type of solutions that are put forward. This involves being wary of the trade-offs across different objectives, and also identifying and capturing the win-wins where they exist. FAO and the bank have recently demonstrated that globally, there are ways to repurpose the way governments support the agri-food sector so that it better supports healthy diets while keeping in mind the implications for climate, the environment, and for incomes. This work is now, fortunately, being brought back down to the country level. And it is crucial that we continue to support countries to better think through what it means to operationalize holistic system change. So let me stop here. Again, thanks so much for having me in this panel. Really happy to be here and a very fascinating discussion so far. I look forward to continuing this discussion here and elsewhere. Thanks.
Thank you so much. Finally, we would like to invite Dr. Carol Levin to join us. Dr. Levin is a clinical associate professor at the University of Washington and the project director for strengthening economic evaluation for multisectoral nutrition strategies, which is SEAMS, the SEAMS project. The SEAMS project is a partnership that aims to build evidence on the costs and benefits of multisectoral nutrition projects. So, Dr. Levin, my question to you is, what benefits can we expect by designing agri-food systems, investments to be more nutrition sensitive, and why is it important to articulate them? That's one question. And then also I would like to follow on to ask what tools exist to track them. Over to you, Dr. Levin.
Thank you, Alberta. Good afternoon, good evening, and good morning. It's a pleasure to be here. So we've heard today that investment options to improve nutrition-sensitive agri-food systems include a wide range of investments, from upstream research to production, storage, processing, distribution, embodying all steps along the agri-food system, including food safety, including food consumption. And we've heard that these investments produce big wins when they're strongly linked to actions and investments that strengthen consumer demand for more nutritious diets. But what that means is there are many competing choices in what to invest in to improve diets and nutrition. Even within the agriculture sector alone, there are many choices on where to maximize the impact of investments to improve diets. So how do we compare those benefits and costs of investments along that nutrition-sensitive value chain or impact pathway? To answer that question, let's consider how we typically allocate resources today and think about how we want to allocate resources tomorrow, especially if we want to be nutrition sensitive. Traditionally in agriculture, cost-benefit analysis has been used to allocate scarce resources based on a positive return on investment. This is relatively straightforward to capture monetary benefits associated with increased agriculture production and incomes. However, when we take a more holistic view of agri-food investments, that is when we think about that impact pathway from investment to improved healthy diets, then there are a range of potential benefits. And for economic evaluations, the tool that is used to inform investments, we can think of three broad categories or benefits of agri-food investments. The first of those benefits that we can easily monetize, as I mentioned, commercial or small scale productivity. That is the value of increased acreage or a yield of a target crop. We can capture changes in incomes and profits or the value of home consumption. The second benefit are a range of health and nutrition benefits, including assigning monetary values to those outcomes, such as savings from averted health costs at either societal level or the household level, higher future earnings, or any money that is generated or saved from the intervention. And last but not least is a bucket full of potential benefits related to changes in knowledge and practices for production or consumption, changes in dietary diversity, improved food and water security, reduced vulnerability, enhanced gender empowerment. And these are much harder to measure and incorporate in economic evaluation. Accounting for these types of benefits will provide a broader and more complete picture of an intervention or an investment's effect on communities and households. So what are the challenges and consequences in how we measure benefits today? First, we are excluding many of the benefits in the economic evaluations of agri-food systems. Any exclusion of those benefits, whether they're easy to measure or hard to measure, they will not capture the full economic value of that investment. And so we're underestimating in the benefits of agri-food systems. Second, even in the cases where benefits can be measured and valued, they are not consistently being incorporated in analyses today. A recent review paper on the measurement of benefits and economic evaluations for nutrition interventions, including agri-food systems, found that less than 10% of all studies include benefits related to cognitive and educational gains, dietary diversity, food security, knowledge, attitudes, practices, and even income. Third, there's a practical issue in trying to capture all these benefits in an economic evaluation or an investment analysis, and that is the risk of double counting. So for example, if we did measure the impact of an investment on household food security, if we did include a measure of household food security and economic evaluation, has that already been captured in the measure of impact on a nutritional outcome? So for these reasons, there is a tendency of researchers, applied researchers, to not even try to measure costs and benefits of these programs because they're complex and it's a given that they're omitting so many of these important benefits. But in the absence of robust and high quality evidence on costs and benefits of these programs, the worst case scenario is that we don't have the evidence to convince decision makers to invest in nutrition sensitive agri-food systems. Less dramatically and more likely is we risk not making optimal investments in the agri-food systems that have the greatest potential to enhance healthy diets and nutrition outcomes. And this is especially true in a time of great nutrition transition around the world related to, as we've heard, environment, increased obesity. Fortunately, we can do better and we can focus on how we want to allocate resources tomorrow. We have to first recognize the variety of project types within agriculture that can lead to healthy diets. As Alberta mentioned, the SEAMS project, which looks at economic evaluations of multi-sectoral nutrition strategies, uses its starting point on a typology of interventions to strengthen supply, improve demand, and enable the enhance the enabling environment. Next, we can build on impact pathways and evaluations along to measure both costs and benefits. This can accommodate investments that have explicit nutrition or diet objectives and those that don't. And then we have to recognize the complexity of these agri-food systems and improve standard approaches to generating evidence on benefits and costs. Alberto, you mentioned what tools are available to help build the evidence base. I'll briefly mention three. The first is around the design and implementation of evaluations of these programs and following best practices in this domain. A number of CGIAR organizations, including IFPRI and the International Potato Center, and likely many others, do already use program impact pathways to both design and evaluate agriculture nutrition sensitive interventions. They use a participatory approach, and I recommend that impact evaluation should be building on impact pathways. Second, integrating costing into such evaluations is critical to generate information, both financial costs and economic costs of these interventions. We have a set of tools from the SEAMS Nutrition Program to help design, implement, and analyze cost data for use in economic evaluations. And lastly, I'd recommend checking out the New York Academy of Sciences Nutrition Modeling Consortium, which brings together several helpful tools for informing investments in agri-food systems. Thank you.
Thank you so much, Carol. And thanks to all our 5 panelists for these very enlightening presentations. Before we move into the question and answer session, I would like to offer the floor to our colleague, Kedar Mankad, a senior program officer with the Bill and Melinda Gates Foundation, for a few words of reflection on the experiences shared by our panelists so far. Mr. Mankad, over to you.
Thanks so much, Alberta. So I think, and thanks to R4D and FAO and for all the panelists for their remarks. I think clearly what we've seen today is that there's a strong need for more discussion and sharing of learning across countries on how, especially within the ag sector, we can optimize investments to impact nutrition. Because at the end of the day, you know, ag systems should serve consumers, and the fact that healthy diets remain out of reach for most of these consumers necessitates we reevaluate how these systems run. So to do that, to sort through the evidence on cost effectiveness, on return on investment, and how to ensure ag systems deliver both financial as well as social returns requires new tools and better analysis of data to provide policymakers with straightforward and self-evident solutions. I think this is probably the only way we can take the conversation out of the abstract and into actually impacting real-time decision-making. So the themes that the R4D team has extracted from the work are really important because we've often described the lack of evidence as a barrier to integrating nutrition into agri-food systems. We've clearly reached a point based on all of the panelists' wonderful interventions that this is no longer accurate. And so I hope that those examples can serve as further proof that integration, mainstreaming, whatever you want to call it, nutrition isn't an abstract notion, but can really happen with concerted efforts. So at the Gates Foundation, we've made getting this kind of country-specific evidence into the hands of decision makers a key priority. We've learned from the global food crisis that there's no way we can approach these issues in silos. The food system's integrated, therefore our solutions must also be integrated. And also communicating the evidence on what works, on what's achievable within existing policy and financial constraints is critical also to addressing inequities from who benefits from the current agri-food system. So from our end, we're investing in better understanding what drives consumer demand for healthy foods, on how market infrastructure can be improved to ensure that food loss and food safety are prioritized, and on translating evidence on diets to help inform policymaking. So I'm looking forward to listening into the Q&A. Thanks again for the opportunity to reflect on what we've heard today. Back to you, Alberta.
Thank you so much, Kedara. We are now moving on to the question and answer session, and I would like to introduce Benoit Veliret, Senior Economist at the FAO Investment Center, to facilitate the discussions. Over to you, Benoit.
Yes, thank you so much, Alberta. Can you hear me well? Yeah? Okay.
Yes, we can.
So I assume this is okay. So thank you so much, Alberta, and all the panelists and Kedar for the very inspiring discussions so far. So as Alberta was mentioning, I'm part of the investment center of FAO, which basically is providing support to the countries to develop some of the investment programs and plans that we have been talking about to discussion. And obviously, we are also very much interested to improve the way we work and to improve the impact of our work on institution. So I was asked to facilitate the kind of Q&A. So as a basis, I will take some of the questions that you have on the Mentimeter application. And I will start with the question which received most votes, which is about climate change. So I read the question. The recent COP27 was about the urgency for climate action. So how can we ensure that the investments to maximize investment gains or nutrition gains, I guess, are not at the expense of the climate change agenda? So are they win-win? I guess win between the climate change agenda and the nutrition agenda. So I would like to ask the question maybe to, if you don't mind, to Adriano, because we know that Bangladesh is very much affected by climate change, and possibly Felipe, because I understand that the World Bank has also a climate change agenda, in addition to the nutrition one, and Patricia from FAO. So should we start with you, Adriano?
Yeah, sure. Thank you, Benoit. Thank you for the question. Well, essentially, there is the resilience aspects in the CIP3, and the way it is treated is that it's treated as within the CIP3 as a dummy. So there is a marker which is climate resilience, essentially. So to capture investment within food security, within the food system, we ask the question whether this specific program or project component is able to tackle climate resilience. So if the answer to this question is yes, then the marker is on and that budget will be attributed to climate resilience. And so this would provide the contribution of the country investment plan to tackle climate resilience.
Thank you, Adriano.
It's not easy, it's not perfect, but that's the approach.
It's a very concrete way, yes.
And also there are other markers within the CIP3, which is food loss and waste, which followed the same approach, and also regarding gender disparity. So that's also the same approach, and the food safety issue as well. So these are typically cross-cutting issues that cut across the 35 investment programs. So we would have had issues of double counting if we had excluded them from a specific program. So therefore, this marker approach. Thank you, and
thank you very much. Yeah, that's great. Felipe, you want to have a try?
Sure. Let me comment briefly. So on the costing side of things, we have been doing the climate co-benefits costing for quite some time now, right? And where we need to catch up a little bit on the World Bank's portfolio is the costing of nutrition. And so, for example, in South Asia, we're now monitoring both climate and nutrition financing for the same project. So that's how we're thinking about integrating that. And there are win-wins, right? We see projects where the investment is shared for both nutrition and climate. Two other thoughts. One is we know that the trade-offs and the win-wins really vary at the country level. And so the assessments that we do should really focus on countries, even at the subnational level. We've done a recent paper with WFP in Bangladesh looking at diets and the implications of diet changes, transitions for both nutrition and climate. And I think those types of analysis are really, really useful for the clients that we work with. And the question then is, how do you make these types of assessments and tools accessible to those who have to make the policy decisions? One thing I'm really excited about is the work that WFP is doing with other partners to develop an optimization tool called Enhance. It's been in the works for quite some time. And the idea here is to have policymakers be able to unpack for themselves the policy impacts of diets and to assess trade-offs and win-wins across these various outcomes. So climate, nutrition, but again, a whole range of other things. And I think that's a direction we sort of need to support. I'll stop there. Thanks.
Thank you very much, Felipe. Patricia, you want to have a try also? From the FAO side? Okay.
Yes, sorry. Excuse me.
Okay, that's okay.
Yes,
We can't see you, but we can hear you.
Can you hear me?
Yes, yes, we can hear you.
Yes. Yes. So what we have done, and I will not repeat what the other speakers have said, but we have integrated impact pathway in the context of climate change adaptation and mitigation. And when you start to look at that, you have healthy diets on the one hand, but also biodiversity becoming increasingly important when looking at transformative actions as really the two levers, biodiversity and a healthy diet, that really can be seen as foundation. And this is very important because it has been mentioned already, the relevance of identifying co-benefits that are not only important for one sector, but across multiple sectors. Thank you.
Thank you very much, Patricia. I think we move to another question. I apologize to colleagues because we will not have time to ask all the questions. There is a question specific to Dr. Siste, who talked to us about the Africa Declaration. So Dr. Siste, would you please elaborate on the important link between the resource tracking and partnership management and the Triangle of Knowledge Partnership that the Secota Declaration has initiated? Over to you, Dr. Siste.
Thank you so much. In terms of the link between the Secota Declaration and the Triangle of Knowledge Partnership is that the Triangle of Knowledge Partnership consists of 25 plus universities where we are implementing the Secota Declaration. So these universities, through the resource tracking and the partnership management capacity building that we are doing with Result for Development, will be an asset, especially at a district level, to build the capacities of the district level implementing sectors and the stakeholders to generate a financial information in terms of the amount of resources that they allocate for nutrition specific, nutrition sensitive, and climate smart infrastructure interventions, the amount of resources that they spend for those interventions, and also the amount of resource needed for the investment needed as part of the Secota Declaration implementation. So these universities will be a link to generate the evidence base to improve the quality of data that will be generated at local level, and also to help the local level informed decision making. And finally, also they help the districts or the waradas in terms of the financial advocacy. So the linkage, we call it the triangle of knowledge partnership. It is because the triangle is between the universities, the implementing district level stakeholders and the policy makers, so that information can be generated, utilized, decision made, and also for resource gap advocacy efforts to be made. So that is how the triangle of knowledge partnership will be linked to the resource tracking and partnership management tool. Thank you. Over to you.
Thank you very much, Mr. Cissé. I was curious to know more about the triangle of knowledge. Thank you so much. I think I will go to a third question now, which actually is about private investment. The question is, how can the recommended actions that we are highlighting here influence private investments in agri-food systems? So I understand, yeah, because we talk a lot about public investment, I guess, so we're talking about now. So how can this also influence private investments in agri-food systems? I don't know who wants to reply. Can I try with maybe Carol? I've not asked questions so far to you. Over to you.
Yes.
You're on mute, Carol.
Yes.
Yes. Yes, sure.
I'm looking at the question.
Difficult question.
Recommended actions. Yeah. How can recommended actions highlight, adhere, influence private investments in agri-food systems? I suppose through strong partnerships. I think there is an effort to engage the private sector. I think it's challenging to allocate scarce resources to the private sector when they do have other means of raising funds, but partnerships, equal partnerships, where they're engaged and they value improved diets and nutrition outcomes, right? And we do see increasing obesity and diet-related diseases in addition to malnutrition. So forming strong partnerships, maybe, having principles of do no harm and new investments. I think the same set of guidance that the public sector uses could be used for the private sector. We have observed that hasn't been the case to date. So I do believe it would take some radical change in how we partner to have mutual sharing of improving the food system and diets.
Thank you very much, Carol. Adriano, you raised your hand.
Yes. So basically, what happened with the Bangladesh country investment plan is that while this investment gap was identified, also the original consultation brought up the issue of lack of cold storage facilities. And then with the hand-in-hand initiative, so FAO Bangladesh and hand-in-hand initiative went vertical, developing value chain analysis and showing to investment partners that there is, there is a potential gain out of this. So I think there's a good complementarity between investment, country investment plans, which go horizontally, essentially, and value chain analysis vertical to then show where gaps lay. So this was brought up by, as I said before, by the Ministry of Agriculture of Bangladesh in the recent hand-in-hand investment forum in Rome. So this could be a good example of positive interaction.
Thank you. So if I understand correctly, Adriano, the country investment plan would identify some space for private investment in the value chain that contribute to better nutrition. Yeah. Okay.
Exactly.
Felipe, do you mind if I ask the question also? Because the World Bank has also a private investment arm, IFC. So how this is applied in case of private investment?
Sure, and I know that the IFC has some nutrition principles. So the private sector arm of the World Bank Group has principles on how they invest. including nutrition considerations. So that's something that's an important part of the full set of investments that the World Bank Group supports, both in the public sector and the private sector. But another quick thought, Benoit, if you might allow me, is around the World Benchmarking Alliance, right? I think it's very hard to engage with the private sector without a clear understanding of where they are on various set of outcomes. And I think the metrics and the measures the World Benchmarking Alliance puts forward, whether or not it's complete or the best one, it's one way to start engaging with the private sector and say, okay, here's how we know these X hundred companies in the food and consumer market goods sector, this is how they're doing, right? And these are big companies, and we know what the benchmarks say about climate, environment, and a lot of nutrition as well. And so that's a good starting point to start talking to firms and being and solving sort of this collaboration between what we do in the public sector and the private sector and doing it together with them. And so I feel that that's one trigger to initiate sort of collaboration with the private sector in this space.
Thank you so much, Felipe. I might ask the last question to the panelists. Again, sorry for colleagues who had other questions in the chat or in the Mentimeter. But as we said earlier, these are read by the panelists, so they will kind of reflect on them. But there is a question which is addressed to all panelists, and I would like to address it to all panelists and asking you to maybe spend 30 seconds, 1 minute each. And the question is quite straightforward. So if funding for nutrition doubled in your program or in your country, how would you spend it? It's a very straightforward question. So can we start, Kishan? So maybe you have not asked a question. So let's start with you. Over to you.
With the double fund for nutrition, I would certainly strengthen the data generation and the surveillance capacity that Palestine is able to express. This is fundamental also for the effectiveness of the effort of building a national investment plan, because we mainstream nutrition, but at the end of the day, we don't have benchmark indicators and impact measures calculated at least every year. So, and given that the funds that traditionally have been used specifically for nutrition are not much, even if you double this amount, I would try to have a better picture for a better documented awareness for those public or private operators, mainly donor countries, that should invest specifically in that segment of activity.
Thank you very much, Krishan. So it would give to increase surveillance capacity to better inform investment and making investment more useful. Can we move to Adriano, because we're talking about investment plans? In Bangladesh, investment plans has how many? You say 36 investment programs. So what would be the priority, you think, for the country?
Thank you, Benoit. I think it's a very interesting question, and I would go personally. I think specifically for Bangladesh, there is a dispersion of money spent for research is really incredible. I mean, we have been discussing this with CGR colleagues. So, and the expenditure for agricultural research is actually decreasing, is like 0.3% of the GDP. So I would try to trying to trigger some trickle-down effects on that, on effective research, not you know, throughout the research center in Bangladesh, but to specific ones.
To target research which can contribute to better nutrition. Yeah. Okay. Thank you very much, Adriano. Now I would like the same question to Dr. Cissé. What about in Ethiopia? Over to you.
Yeah, thank you so much. I think if we get an opportunity for increased investment or doubling of the investment, we have the Sakota Declaration Expansion Phase Roadmap in the investment case, which extends between 2021 and 2030 to reach 240 waradas or districts, over 27.9 million people, and over 1 million pregnant lactating women, and also over 2 million children under 2 years, which the funding requirement is already indicated in the investment case, 1.85 billion for 10 billion USD for 10 years. So we have already identified that there is a huge funding gap. So if we get an opportunity of doubling the investment for nutrition, we are going to fill in the expansion phase roadmap and investment case so that we can reach the critical mass of the population and achieve the goal set that we have already set for the ending stunting among children by 2030. So that is how we are going to spend. We have the investment case and we are going to spend on that. Thank you.
Thank you so much, Cissé. It's a very ambitious plan, yeah. Felipe?
Sure, and thanks, Benoit, for moderating. So the way we invest in the bank is we invest in the agriculture and food space on one hand, and on the other hand, we also invest in the health and nutrition space. And so one way to do that, to cover the whole agri-food system, the whole chain, so to speak, is to, in the same country or in the same area, integrate 2 projects. Another way to do that, and this gets to the question of, if you could double your nutrition investments, what would you do? Is to, within the agri-food project, is to build in a little bit more of consumer-focused interventions. And that ensures more explicit integration across what we do in the agri-food rural production space, all the way up to what we do with consumers, all the way up to landfills. And so for me, it's a lot of this social behavioral change interventions in these agri-food projects, but also building in urban food systems pilots in agri-food projects. We're starting to see that now in our portfolio. And if we double nutrition investments, I'd like that to really focus on that space if I could decide where that goes.
Thank you so much, Felipe. That's great. Yeah, consumer focus, so important. Let's finish with Carol.
Yes, thank you. So since I live in the United States, I'm going to talk about how I would change it. Currently in the United States, over half of the US Farm Bill budget goes to nutrition, specifically the Supplemental Nutrition Assistance Program for vulnerable households. So what I would do is I would invest in 2 types of programs. One, a program that actually treats healthy food as a medicine for our exploding diet-related diseases, such as diabetes and cardiovascular disease. I actually recently heard about a pilot that's being implemented in the United States to this effect. The second would be a program that provides incentives to the ag sector on regenerative agriculture, more diversified cropping practices in the production domain, and then something related to improved food distribution logistics. COVID sort of showed to us how awkward and skewed our food distribution systems are, and our inability to distribute food to food insecure areas when needed. Over. Thank you.
Thank you so much, Carol. That's very interesting. I want to thank very much all panelists, Research for Development, Nutrition Intelligence here, and all participants. And before we close, I would like to hand over to John Bracing, who is the Deputy Director of the Investment Center, in which I work. Over to you, John.
Yes, thanks a lot, Benoit, and thanks to all the panelists and all the other people who interacted in this. I was really quite piqued by this. It was a great conversation. And I'm not saying they're parallel worlds, but we have similar discussions about some of these very same topics, including Carol's last point when we talk about our agri-food systems. And I know that nutrition-sensitive agriculture and agri-food systems go together, but sometimes there's two different sets of groups who are talking about these. But today I saw them pretty much together, especially also with Philippe's comments at the end of how we would integrate an urban component, let's say, to an agricultural development, a classic related project. But in any case, I'm the Deputy Director at the Investment Center. And I think you all might know that our mission as it is to help to design large-scale investment projects, providing technical support to the World Bank, IFAD, and other IFIs in support of member countries as they take on these large-scale indebtedness, hopefully with taking in the best practices and the best evidence to and tools, etc., as these are designed and then implemented. So I'm particularly happy to be, we're partnering today with R4D and of course our own internal partners, our nutrition group, ESN, because that's one way that we can try to infuse more evidence and best practices into improved designs. It's maybe the only way. So we really appreciate that. And I really like the individual topics, whether it was sort of like the framework of how to look at this, or some of the tools, or even considering cost-benefit analysis directly on nutrition project, which I see on the screen here. We have maybe half a dozen of our economists from the investment center, so I'm sure they're quite keenly also looking at that. And for this work, we're under an umbrella program that we have at the investment center called K for I, or Knowledge for Investment, where we try to look at promising new areas or the body of evidence to try to influence and guide newer investments. And so to this, we have other topics looking at climate change and adaptation mitigation tools and instruments to measure those. We have ones on human capital, agriculture, human capital. We have other ones looking at carbon neutrality, and the list goes on. Many of these are, in fact, with our partners, both research institutes, but also with our major IFI partners like the World Bank. And again, it's probably the way we can upscale all these group lessons learned. And in particular, I spent 8 years as a FAO country director in 2 countries. So I really appreciate the hands-on way we can downscale this, because it's not that exciting to only talk about the great tools, instruments, and bright thinking, but also what is actually working and how it actually works at the country level. So I particularly appreciated that. And maybe just to close by, again, thanking Benoit, Patrizia, and the ESN team, and also to say that we're also looking for other knowledge for investment studies that we may take up. And we have a series which is everything from a bit more in-depth directions in investment to more country highlights, and then shorter investment briefs, and then finally toolkits. And those are the 4 ways which we're trying to support our collective wisdom here as we seek better investment designs. And so on behalf of the Investment Center, I really thank everybody, and I learned a lot today. And like I said, my curiosity was piqued by the different interventions. So thanks again, and have a great afternoon, and let's invest more and better in nutrition. Thanks. So then what, is that it? Or are you going to close this?
Yeah, I think that's it, Laura. I guess this is it, right? Thank you so much, John. It was very good. Yeah.
Great. Thank you to everyone for a great session. Have a wonderful rest of your day.
Yeah. Goodbye. Bye-bye to all.